Take 5 with MPOWERHealth. I'm Camille Hepola. Thanks so much for joining us. I'm here with CEO and founder of MPOWERHealth, Scott LaRoque. So great to see you, Scott. What is your vision for MPOWERHealth?
My vision for MPOWER is to help support physicians and their practice and help them compete in a value-based world, creating a model that is both sustainable and rewards physicians for taking on increased responsibility and owning the quality of their care and the outcomes of their work.
It's hard to argue with the premise of value-based care and the focus on improving quality and lowering costs. Will this mean independent physicians will make less money?
I think it's a common misconception among providers that value-based care and its goals to lower costs ultimately mean that they will make less. I think in the value-based world, under the proper models, physicians are incentivized to take on more responsibility with the outcomes of care, but payers are willing to pay more for higher levels of care if it can be measured and reported on. So I think by providing the tools necessary to tell that story on behalf of these physicians, there's a real opportunity for the physicians to walk away being the winners.
What are some of the challenges that you're seeing?
Some of the challenges I'm seeing currently in healthcare and challenges for the independent physician are the lack of access to data to tell their story and to tell the value that they bring to the market, in transparency of costs. And there are several legislative efforts underway currently to help make the costs in healthcare more transparent. I think that will automatically shine a light on those who provide more value or more cost-effective healthcare.
And really, how does MPOWERHealth help with that?
MPOWERHealth helps by setting up the infrastructure behind the scenes to harvest data throughout the practice, compare that data to what other practices are doing, and provide that insight back to the practice. It can be very difficult to understand what great looks like within an independent practice. So we provide the tools to be able to look across the aisle and see what other great practices are doing around the country.
So 5 years from now, what do you see for independent physicians?
5 years from now, I expect the market will realize the value that independent physicians bring because of better transparency for costs across the entire industry. I really think that we're reaching a point where data and insights re-highlight the value of the independent practitioner and shift value back in that direction. And I think with refining some of the value-based care models and payment models that exist today, physicians will see that they have the ability not only to reduce the total cost of healthcare, and that performed at large scale will make meaningful differences.
What sets MPOWERHealth apart?
I think we've really found that our purpose is to help independent practices survive while having the autonomy to make many of their own decisions. We really look to provide the support and the infrastructure so that physicians can make their own choices. I think MPOWER really brings to bear all of the resources, technology in a modular format so that physicians can use what they need and pass on other areas, but really being a one-stop shop for all of the infrastructure, scalability, tools, and technology that a practice needs to thrive today.
I know I've heard you say it before that this really is a win-win-win for the providers, the payers, and the employers. So great work that MPOWERHealth is doing. Thank you so much for your time.
It's been a real pleasure. Thank you, Camille.
Thank you again for joining us. For more information on what you heard today, head to our website.